Dr. Paul here. How many of you parents of newborns realize that being born is traumatic? You ever thought about that? It's trauma, folks. It's rough. The body is scrunched in the womb and it's pushed out, or in the case of these tough deliveries, pulled out. We're going to share with you a little baby. Some of you have seen this little one before. And there's a story here of a breech birth and then what the effects that had on the hips and legs in particular. Our body worker, massage therapist Dee Dee Hoover, who really specializes in babies, is going to talk about what that did and what she's been doing to help this baby.
This little cutie is, I think he's just a little over a month now. He was born Frank Breech. So Frank Breech, different than other breeches, is when the legs are up or they're either completely crossed and it's butt down. And so even with a C-section, the butt generally is being pulled out first because they can't get the legs to come down. This baby couldn't get the legs to come down at all.
Basically, if you're not head down, you're breech. And there's different presentations of breech. This baby had legs up to the head and came out kind of like that, right? Butt first.
Some Frank Breech babies can be born vaginally. He got completely stuck, so he had to be born by C-section. And so when he was born, legs were up the first time I saw him. They couldn't get him down.
Yep. And you would go to put him down and they were stuck right here.
Yep.
Yep.
Yeah, and his were stuck. One was completely still up. Now he's there. He's able to pull him down. I'll show you some techniques that I use to do that. But again, it used to be that we thought, even with birth trauma, they just outgrow it. Well, what we find is they don't always outgrow it. Sometimes they grow into that tension. Hi, cutie. Does that feel good? So he had some tightening on one side of his neck more than the other. He had his arms completely up, kind of like this, and the legs. They were up like this and legs were up. So what I did, I call them squishies, and I teach the parents how to work on the legs. So they were up a little bit more, and I just massage and I work going upwards towards the heart, working with circulation and just gently working. And I teach parents, if you're unsure of where to push you. If you're unsure of where to push or how hard to push or any of that, you can just squish. And they let you know. They'll talk to you. If something isn't feeling good, they'll let you know. The most important thing, if you're working on your baby with some tension, is we never go against what they want to do. So, for instance, if he's pulling his leg up hard, I can work with it, I can massage it, and I can kind of get him to want to bring it down by relaxing those muscles. Then they'll come down. I don't ever pull down because that's going to work opposite. His little hips, the anterior muscles that are inguinal muscles, they have all the same ones. They're just not as big or developed as ours. They run right through here from the abdominal down to his leg. Well, they were really tight. So I just work gently and rubbing. What you doing up there?
I'm doing very gentle cranial work.
Okay.
And I'm going with where he wants to go.
Okay.
So when the camera was over, he actually has a real interest in the camera, so I just allowed that. I have the gentlest of pressure with my 2 fingers on either side of the occiput, and I'm just a very, very gentle, subtle pressure that way. And that usually relieves a little bit of the tension, but I'm not forcing against anywhere that he wants to go. Is that okay?
It's awesome. And the reason that I asked is that this is part that you're doing exactly. He's getting 2 treatments in one right now.
Exactly.
You're doing kind of exactly what he needs. You can do it up from there, but when I show parents, if the parents watching and going, well, I want to do that, I normally support behind the head just to make sure. And again, anytime that you're working on them or doing any work, we want to make sure that they're supported, that they're on something softer, that they're in a relaxed position. That is beautiful. That is very awesome. And so you're working on that. And again, same thing like for stretching. I normally wait till they're asleep to stretch them. You can let their head turn gently though, like Dr. Paul is doing. And that really helps them. Again, back to the legs. Just kind of gently massaging and working and helping with that circulation. He's ready to walk. There he's gonna go. anytime we sort of put them in the position that is ideal. So if they're turning their head really hard and we massage them and work on them to correct that right side tension, when we get back to neutral, we want to support that. Again, nose even with sternum. Same thing with his legs. We want his legs just kind of to be more relaxed. So we do the things that sort of help that. Muscle memory is a thing even this young. So the more that we do to assist the muscles in what they should be doing and how they should feel, that helps him grow out of that tension and helps him develop and grow to his fullest growth potential. That's what happens sometimes with kids, with babies that are born super early. Preemies, a lot of times there's so much birth trauma that sometimes they're failure to thrive.
When I was working on the Indian reservation in Tuba City, Arizona, some of the Native American tribes would put babies on a papoose board, and that would force those legs straight. And that is not something you want to do. You don't want to put pressure on that hip, because this is actually the neutral position. And if you force the legs down, think of the femur in the hip socket, you're really putting tension on that joint, and that can actually be really bad for the hip. So the neutral position is like this, with kind of frog leg, but what we're working on is see that tension and resistance from having been born like that. You do want to release that tension, which is what Dee Dee's been talking about. There you have it, folks. Even babies can get benefit from massage, but this is no ordinary massage. When I always used to think of massage therapy for babies, I'm thinking, what? I'm thinking of laying by the beach at some resort having a little nice massage. This is real therapeutic work, and the benefits to babies is amazing. What would you guess? What percentage of babies could benefit from body work?
As far as benefiting from body work, every single baby can benefit.
Yep.
Now, most people, when babies are first born, if there isn't an issue, meaning the head is stuck one way, frank breech where the legs are stuck, if there's not an issue, then it's truly preventative. And even some of the babies, after I've worked on them and we've resolved an issue, they'll still kind of bring them back to make sure that they keep growing and grow to that full potential. If there is an issue and it doesn't get worked out, like I said, as with time, they grow into it and it can get harder for them. And sometimes some things aren't as resolvable a little bit older than when they're first born.
It's so easy to make massive improvements starting really early. The other things, and you can see other videos about this with babies, is if they're having trouble with latch, with feeding, if they're having trouble with fussiness or colic, if they're having trouble with sleep, they're irritable. A lot of times it's spinal tension, a lot of times it's muscular tension. It's more than just your traditional cranial sacral work.
And basically with cranial sacral, you're working with a dural tube, you're working more energetic is what you hear, that you're working with the baby on a different level. It's on a brain cellular level. With cranial occipital spinal, a technique that I developed with my own son and that has helped so many, is that we're working at the base of the occiput, that's the O. And with the head, we're working on, some of them have the sutures, the cranial bones
overlapping.
The cranial bones can overlap, and which is
see
perfectly
the
normal.
Right there.
Yeah,
yep.
It's perfectly normal. But again, if baby has a whole lot of tension and he's only laying one way, then that's going to push and not allow the head to grow the way that it's supposed to. So the cranial massage is not just that holding, but I'm doing techniques and things that work. They normally like it. And just working with that fascial tissue and some of those muscles to relax. And then occipital, I think I just explained that, is at the base of the ridge. All of those muscles all of the muscles, cervicals, thoracic, all of the muscles of the spine come up and attach right up underneath and on the occipital area. So sometimes we just working on that, gentle massage, gentle techniques. Sometimes it's still pressure. That helps with increasing the circulation in there, allowing the muscle tissue to relax and allowing the baby to get more freedom. While his head's doing really well.
Yeah,
he used to not turn quite that
well. He turns
well.
both ways quite well.
Yeah, he's doing really good.
And then the spinal.
And then the spinal, all of those muscles down the spine. It's musculoskeletal work that I'm doing. We're working with the muscles and we're working with the skeletal system to allow him to to grow as well as he can. And it's the same thing with the legs. That femur bone sits in the hip a certain way, and it needs to stay there in that certain way. Sometimes with frank breech, like you said, they may not even be in the socket, so they check that at birth, and as long as that's okay and the baby's femur bone sits where it's supposed to, we can just work on that muscle tissue to make sure that it stays that way.
So in closing, would you hold this baby like you normally hold a newborn, and it looks like you're doing nothing but you're actually working?
Oh, you mean, do you want me to work on him?
Yeah.
Okay. So
a lot of times, just as an introduction, when new babies come to Dee Dee and she picks up the baby, she's like taking over my baby whisperer role, which, oh well, I have to say you are the
right.
master.
Yeah.
But she'll be holding the baby, like right now is one example. And most babies settle right down, and they don't realize that this hand right here is doing some work. Sometimes this hand is also doing some work.
With him, I'm working on his leg too.
Oh, you're also working on the leg. See, both hands are always working, but it doesn't look like she's doing anything unless you really know. This is sort of the art and skill set that most massage therapists do not have as far as working with newborns. They don't even know kind of what to do. It's subtle, it's gentle, but it's very powerful work in that COS region, right? From the cranial to the occipital, all the way down the spine. There you have it, folks. I hope you enjoyed this. Stay tuned to our channel, and also we'll provide links to other work that Dee Dee's doing. Thanks for watching.